From the city to rural North America, this is Rural America Live, connecting the people who grow America's food and fiber with those who enjoy it. Call in, let's talk. It's Rural America Live.
Weather is cooling down around the country. Pets, horses, changing activities. The horses you see are changing pastures perhaps as we move into the fall season. Our friends at Vetericyn have put together a great panel of our show tonight to discuss care of your horse and other animals as well, should they get a severe cut or an infection of any kind. Good evening, I'm Mark Oppold. Welcome to this edition of Rural America Live. Indeed, our friends from Vetericyn joining us once again. If you haven't heard about this product or seen some of the success stories, you are in for an interesting and educational hour. I hope I'm glad you are joining us. Hope you'll take careful notes. We'll be opening our telephone lines a bit later for you to ask questions of our panel. Tonight, we're going to be discussing Vetericyn's line of animal health care products. Also, show a new human wound and skin care product. The makers of Vetericyn have recently launched as well. So lots to take care of. Joining me in studio, in fact, we welcome back equine veterinarian Dr. Brad Gordon from Des Moines, Iowa. Always good to see Dr. Gordon with us. And we welcome back as well, been a while, Scott Van Winkle from Vetericyn is with us as well. And we also have a fan favorite of RFDTV. A lot of you horse owners and horse lovers know all about horse trainer and clinician Clinton Anderson, host of Down Under Horsemanship, seen every Tuesday, 2 p.m. and 10 p.m. Eastern, and 3 p.m. Eastern every Sunday on RFDTV. Clinton Anderson joining us by telephone later this hour. So welcome to Rural America Live.
Thank you, Mark.
Good to have you here. Before we get too far in, real quick, Dr. Brad, give our viewers that may be watching for the first time a quick background. A lot of education going into you becoming a veterinarian.
I went to and graduated from Ohio State, did an internship, 2 residencies, was a university faculty member for a while, and now I'm in Des Moines, Iowa.
And talk about the clinic in Des Moines, your business there.
We see a variety of different horse problems, and also part of our practice is associated with Prairie Meadows Racetrack in Altoona in Iowa.
And how long have you been using the Vetericyn product?
I first got acquainted with Vetericyn around 2005. We were one of the veterinary clinics that was asked to evaluate it initially.
And we're going to spend a lot of time about horses, but I guess right at the top, you want anyone who has a pet of any kind, an animal, 4-legged creature, really, of any kind, as a veterinarian, you'd be glad to hear from them if they have a question about a wound or something that's not healing correctly.
Correct.
Good to have you here.
Yes,
Scott Van Winkle, you were on one of the first couple of programs, one of the second program here, but good to have you back.
Thank you.
Extensive ag background for you as well.
Yeah, Mark, I grew up in North Central Oregon, and my mom and dad have a Black Angus cattle ranch back home, and so I got to grow up and experience that, and moved to Idaho to study, and I ended up at a hunting and fishing lodge over there. So I spent a number of years packing hunters and fishermen in the backcountry using mules and horses, and got firsthand experience with Vetericyn during those days. And now, a few years later, I'm now Director of Marketing for the animal health for Vetericyn.
And as we mentioned earlier, you're going to be talking about a new human product as well. So, I mean, we all get scratches too, and burns, sunburns, whatever it might be. And there's a human product that we're really pleased to talk about tonight as well. So.
That's exactly right.
Good to have you here. And as we mentioned, Clinton Anderson joining us by telephone a bit later this hour to visit with us as well. Certainly another good example of someone who uses the product on I'm sure, a daily basis here. So let's get started, Dr. Brad. Tell the viewers again about Vetericyn and why it's something that you use in your practice.
Well, Vetericyn, Mark, is an innovative, new generation topical skin preparation that can be used for a number of maladies. It's easy to use, it's non-toxic, it's not an alcohol, it's not an antibiotic, it's not a steroid, it's not tea tree oil, it's not iodine, it's not chlorhexidine. It's safe to use on any animal, like you mentioned, and it can be used safely in and around the mouth, the ears, the eyes, the nose, wings on birds, tail, feet, and that's any species, any age, young or old. It hydrates tissue, so it's safe for an owner to use before they see their veterinarian, and it cleans and debrides and moistens wounds, so it does this without causing any problem or harm to normal healthy tissue. And the active ingredient, hypochlorous acid, has been shown to be strongly antimicrobial in that it kills bacteria, fungus, and viruses.
Yeah, that's a lot to cover in a short time, but it really does speak well in a broad, and thank you for a broad overview. I think one of the things, though, was one of the last points you made, that when you have a severe wound or an infection in an animal, treatments unlike Vetericyn will sometimes damage the good tissue that is there.
Yes, the Vetericyn goes a long way to setting up a healthy wound bed, so there's good healing that follows and rapid healing.
And you don't need a prescription.
No.
It's a spray. We'll talk there's gels as well, but it's easy to apply. You can't overuse it. Probably, I don't know if you can you underuse it, I suppose?
Yes, the more you use it, the better, but animals don't mind its application, and it really goes a long way in helping tissue healing.
Scott, when you joined us the first time on one of our second programs, I believe, the company, Vetericyn, looks a lot different today than it did then.
It sure does, Mark. Yeah, we've really grown the company. The team's done a great job in doing that. We really focused on the equine market when we started. Now we have a livestock line, a veterinary line, and some new products we'll talk about in a little bit. And you know, as you mentioned, Brad, the hypochlorous is really changing. There's a paradigm shift in wound care management right now, not only in animal health but in human health. And hypochlorous is a new standard in wound care. And we've been really excited to be able to bring this on the animal side.
Yeah, so you've kind of separated the equine and companion line, I'm going to say, with livestock markets. Is that right?
That's correct. Yeah, we have a full line of livestock markets. We have our products that are based on hypochlorous technology, and then we also have a new Super 7 naval dip product that we launched in 2014. We'll talk about in a little bit.
Yeah.
But yeah, we also have a pink eye product specifically for mainly for the dairy business, but can be used on any animal.
Mm-hmm. And then, of course, the introduction of the human product as well.
That's right. Yeah, we also have some very exciting movements this year with our human line. We launched a product called Puracyn Plus, and we'll be talking about that in a little bit. But that is also a hypochlorous-based technology.
Very good. And by the way, as we talk about, there's Puracyn Plus. Anytime during the hour, we'll be showing you an 800 number that you can call. Tonight, there are operators standing by with Vetericyn from the Vetericyn office that will be glad to talk to you and take your order tonight. And then regular business hours, you can still use that toll-free number, if not tonight. Later on, if you need the product or want to learn more about it or to order it later. But if you want to order tonight, they are standing by, and we'll be giving that number on the screen several times during this hour. Just a little bit of Vetericyn 101 here, Doctor, from a veterinarian. Let's kind of maybe talk a little bit about how the wound and skin care products actually work.
Well, the Vetericyn is a new generation wound and skin cleanser that was designed to enhance the most essential part of the wound healing process, and that's preparation of the wound bed. Mm-hmm. This pH balanced hypochloric acid solution was designed to be able to use to clean, irrigate, and debride a wound, thus setting the wound up for ideal healing conditions. And in the process, it's a good new advancement and alternative for saline and other solutions that were used for that. It's compatible with the normal body production of hypochlorous acid, mm-hmm. and it doesn't harm normal tissue, but it helps the tissue that's damaged. And like I said earlier, at the microscopic level, it works by being antimicrobial. It improves oxygenation at the application level, and also it stimulates generation of ingrowth of new blood vessels.
We may get a caller or two that would ask a question, but I would just kind of throw it out there. They wonder, well, how long does it take any longer or less time for a wound to heal? Of course, it depends on how deep the wound is, but generally, is there any time factor involved here?
In studies in research animals, it was shown to improve the healing time by about 60%.
Okay. We have some in photos. I'm not sure we have some thoughts of our before and after. Maybe talk a little bit about what we're seeing here. Wow, there's some impressive results here, Doctor.
These are some testimonial photos, and Scott may be able to address them too, of before and after applications of the Vetericyn. And as their documentation shows, that the wounds have healed on an average of 60% faster than they would have if other treatments had been applied.
Mm-hmm. Impressive photo, Scott. And I understand that in the hydrogel wound, you have used the hydrogel wound spray as well. And talk a little bit more about that.
Yeah, the hydrogel spray is still, all of our hypochlorous technology is still based on over 99% electrolyzed water. So it's very safe to use. It's non-sensitizing or stinging. The hydrogel product is a little more viscous. It's actually a little thicker. It's great to, when you're packing a wound bed and you're going to be applying a dressing, and Dr. Gordon can talk a bit more about that. The clear liquid is really good to debride, to clean the wound, and it actually works really well when you're starting to take a dressing off. You can actually moisten that dressing easier.
And on animals in the field, the hydrogel provides a good coat over the wound, so it helps decrease fly contamination of the wound.
Yeah, I was going to ask you when you might use one of the liquid versus the gel, doctor, as a veterinarian.
I personally like to use the solution first and then let that dry and then apply the hydrogel afterwards, so we have kind of a protective coating over the area. Most of the time, if it's under bandage or on some situations, bottom of the feet for thrush, that type of thing, just the solution's used. But if you have a vertical surface that doesn't hold solution very well,
yeah,
the hydrogel is very, very
maybe
good
like
for
a leg of a horse, for example. Yeah, something like that.
Yeah, and we get a lot of testimonials in all the time, Mark, talking about the uses. And one of the things we use the hydrogel a lot for, we see it being used, is when there's dermal skin irritations over time, whether it's hot spots on dogs or a horse is has an itchy spot and it ends up opening up the wound. The hydrogel is really good for putting a nice clear coating on there.
I bet that, again, for viewers, a pet that is scratching the same area and it becomes an infection after a while, which might be a flea or whatever, a tick or something like that. But so the gel might be that would be another example where that would be in use. One of you mentioned the hypochlorous technology, I guess. Scott, is that something that's in part of all of your Vetericyn products?
It is. We actually just separated out. We now have our product line is called Vetericyn Plus that contains the hypochlorous technology. And so our Vetericyn Plus wound and skin care products contain hypochlorous. The couple unique things about hypochlorous is, as Dr. Gordon mentioned, it's actually naturally produced by your body's neutrophils, the white blood cells in your skin tissue. And so we've been able to capture this in a bottle while maintaining a lot of safety, but still having the antimicrobial properties. So hypochlorous is very, very unique and very advanced for a time.
And the nice thing too about the Vetericyn products, it's pH balance, so it doesn't sting usually on application, and the animals tolerate treatments very, very well, whether it's in the eye, ears, where other products they resist and fight, so we don't get clients being able to administer the product as much as they can with the Vetericyn.
And you've been on the show many times talking about how you use the product almost on a daily, maybe a daily basis for you. Maybe give our viewers some examples of how you use it.
So we use a lot of it in the clinic. And most of our clients now, after they've been exposed to it once, like to carry it when they're out on trail rides. They carry it in their trailer, have it in the barn at home, have it in the house for their dogs and cats. So they utilize it a lot. Whenever we have a horse that comes in and we need to do surgery or fix a wound, we'll use the Vetericyn first to clean the wound and prep the wound, and then we'll go ahead and suture or wrap, depending on what we need to do. And that we use the Vetericyn incorporated into our eye care and eye treatments quite a bit. And after surgery, after an injury's been taken care of, we'll utilize the Vetericyn as a post-op solution to be sprayed on the wound a couple times a day. And that enhances the healing.
Maybe a little bit of help to viewers about, we have a veterinarian here, maybe the best way to assess wound for the first time and how to treat it.
Depending on the situation the horse is in the barn or in the field, we like to have a horse controlled first, so have someone catch the horse up, and then we like to look and see if there's bleeding. If there's bleeding, we like to stop that. We like to determine if there's an injury in or around a joint. Sometimes the most devastating injuries are puncture wounds that penetrate into a joint, and people don't think they're very serious, so the horse gets an infected joint, and that's a very expensive procedure to try to correct and treat. The Vetericyn, if you have an open wound, we usually recommend that once people assess the horse, stop the bleeding, they apply that to the wound, then protect the wound with a bandage if possible, and then if the horse needs to have sutures, transport that to their veterinarian or follow up with their veterinarian that comes out on call to suture if have to. If not, follow-up treatments at home with bandages and other therapy, antibiotics if necessary. Anti-inflammatories are critical.
And very good. And again, if taking careful notes, we'll know that you are. We know, we have viewers, that you'll have questions, and we will be opening our telephone lines a bit later and allow an opportunity for you to talk to Dr. Brad Gordon or to Scott Van Winkle as well. And again, if you're just joining us in just a few minutes, clinician Clinton Anderson joining us by telephone to talk about how he uses Vetericyn and his horses and the shows that you see on RFDTV. We showed the full line of Vetericyn products a little while ago, Doctor, quite an impressive lineup of products, but it reminded me of the new one that you were with us when we introduced the new naval dip, that Super 7. Talk a little bit about that.
The Super 7 Plus is a new product for the Vetericyn line of products, but it's not based on the same technology as the wound and skin care products. And it's a desiccant that's utilized for drying out umbilical cords, and it's been shown to be much superior to the other products that have been used over the years. On the video that we're watching now, it's going to be used on a calf, but it's also very, very good for foals, works the same way, and we have people that'll use it on small animals and exotic animals. It does not harm normal tissue. It's safe, it provides protection, and it doesn't sting or stain. And because of its formulation, it's environmentally safe, and people don't have to worry about contracting skin allergies like they sometimes do with iodines, and it works very, very fast. And in many cattle operations, it's only applied once, and they don't have to worry about checking the calves afterwards to see if a second application is necessary, because it gets the job done the first time every time.
Showing a picture there 2 hours after applied, and then 24 hours after. I mean, it's pretty well...
very effective.
Very effective. Scott, there was a study done on this product, the Super 7, that you can give our viewers an overview of what you found out there.
Yeah, when we first had this product in R&D, we were trying to find an equal alternative to 7% iodine because it was getting harder to get a hold of for the producer. And what we did is we came out with Super 7 Plus, and we decided to do a study. We partnered with Auburn University and actually tested it. And we actually did this earlier this year, and we found that we actually have a 30% increase in dry down time versus using the strong 7% tincture of iodine. So this was really a test against the gold standard, and you know, this study really shows that not only are we safer, we're easier on the handling charges, but trying to bring back awareness, too, of how important it is to dip umbilical cords on newborn animals, whether they be production livestock or they be your companion animal or horse, for that matter.
They found out that approximately 3% of illnesses that affect newborn animals, whether they're calves or foals, that occur in the first 3 weeks are due to umbilical infections.
So that's what I was going to... You just took my next question, that why is dry down time so important? You wouldn't think the umbilical cord would be as important as getting that first nutrition into the animal, but...
that's important too, but this way we take care of one of the portals of entry, the biggest portal of entry for infections to occur.
Very good. Our time moving along in this hour, we would be visiting more with our friends. Vetericyn website as well that we have on your screen, or that toll-free number, 866-318-3116 to order product. Right now, there are operators standing by in the Vetericyn office to take your call and take your order. Explain exactly what it is you might need, give them your situation, and they are there to help. Keep that number handy and call it as well during regular business hours. Or if you would like information again in detail, go to the Vetericyn.com website. We're going to take our first break. When we come back, we'll be giving you our telephone number and opening our telephone lines, and we'll have our special guest joining us by phone, Clinton Anderson from Down Under Horsemanship, and opening our phone lines to you. In fact, let me give you that number as we go to break. Our toll-free number to call and talk to us is 877-731-6733. Lines open right now. Don't go away. Clinton Anderson and more from Vetericyn coming back right after this.
Vetericyn, one-step wound and skin care, and the best in animal wellness products.
Hi, I'm Bob Burlingame. I've dedicated a good part of my life to the better care of animals. And over the years, I've learned that people who use our Vetericyn wound and skin care products have pretty huge hearts. I know our products work from the letters and stories I get from people just like you.
Welcome back to Rural America Live. I'm Mark Oppold. Our friends from Vetericyn with us tonight, talking about their wound care, skin care products as well, and later on the human product they've developed as well. Our lines are open, toll-free 877-731-6733. Questions you might have. Again, lines open now. Don't wait too long. We know they're going to be filling up. Again, lots of questions, and we're here, or I should say our panel is here to answer. 877-731-6733. A pleasure to welcome Clinton Anderson, Down Under Horsemanship, clinician, horse trainer, competitor. You see him on RFDTV every Tuesday, 2 p.m. Eastern, and again 10 p.m. Eastern on Tuesday, and then again 3 p.m. Eastern on Sundays. Clinton, welcome to our program. Certainly good to talk to you.
Well, welcome. Thank you very much for having me on the show tonight.
You bet. Absolutely. We wish you were here in person, but understand it's a busy schedule, so appreciate these minutes with us tonight. Give our viewers, they wonder, well, I watch his show, but I wonder, how did he get started? Give us a little background.
Well, basically, like a lot of kids, my grandparents got me and my sister into horses as kids. They had a local farm and so forth in Innisfail, Queensland, Australia. And we'd ride horses on the weekend with my grandmother. She was the real passionate one in the family with horses. And, we just kind of grew up riding horses, learning the best we could. And eventually, when I was 15, I left high school and I decided I wanted to train horses full time and make that my career and living. And, 22 years later, this is where I am now. I've been over here in the States about 16 years, and I pretty much, make my living teaching people how to get along with their horses and form better partnerships. And we've developed what we call the method, and it's basically a home study course for people to train their horses successfully at home by themselves.
Very good. In fact, we know that people would love to talk to you about training horses, but our topic tonight, of course, as you well know, is care for those horses if they would have a wound or an infection. So as we open our phone lines, viewers, keep that in mind. Clinton is here to talk about how he uses Vetericyn and how you might use it as well. Clinton, give us some thoughts about when did you start using it? How did it happen for you, Vetericyn?
Oh, I think I started using Vetericyn probably at least 6 or 7 years ago now. I can't remember the exact year, but I had heard some people talking about this particular product, and I'd never heard of it before because it was brand new, never been on the equine market. Mm-hmm. And I thought, what the hell? They sent me a couple of bottles to try. And to be honest, lots of people send me products and things to try, and, I never really get around to a lot of it. But, everybody claims they've got the latest and greatest thing in the world. And I kind of thought that's what Vetericyn was, to be honest with you. I thought, this is just another product. It's not very good, blah, blah, blah. Well, it sat on my desk for probably 2 months, and then eventually I had a horse that had an injury, that had a nasty cut on it, and I thought, what, this would be a great experiment to try this stuff on. And I really didn't expect, much results from it. And I was absolutely blown away at how quickly this wound was healed, how it came together, the lack of scarring. 30 days later, I called Vetericyn and said, listen, I really undervalue what you did, what your product is. I need to get involved. I want this product. I want it on my ranch, etc. And then, we kind of formed a great partnership since then. But I will be the first to say that I underestimated it. I didn't really believe in it. But once I actually used it, I saw the results. It was absolutely phenomenal.
Dr. Gordon, Dr. Brad Gordon with us tonight, which I know you and Dr. Brad have talked many times. He brings up a point about how important it is to clean that wound as the first step.
Yes, the Vetericyn is a good solution for that because not only flushes the wound and cleans it, but it also has the antimicrobial factors that are very important. And I think his point's well taken that when you first see it, it looks like you're applying water to a wound and you don't think it's going to do any good. But after you've used it, you're convinced that it does work.
Yeah. And yeah, I guess, Clinton, that's one thing you've said over and over. It's safe to use, it's easy to use, it's fast, and it does the job by itself. You just get, as long as you keep spraying it, it's going to get the job done.
Yeah, and that's one thing I will comment on. Probably the biggest thing when people are first using the product that they're skeptical about is it just kind of looks like water. You know what I mean? It's like, how the hell did I spend this money on water? This ain't going to do anything, and it really does. And people have a tendency to overuse it in the beginning. When I say overuse it, you can't ever do any damage by overusing it, but they waste a lot of the product because they think that 20 sprays of it is going to be better than 3 sprays of it. And often I tell the people who work for me, put it on a wound, if you can 3 or 4 times during the day, at least twice a day, but 3 or 4 times during the day. You only need, 2 to 3 sprays of it. It's covered the wound, and it's constantly helping it along. I joke on tour and so forth. I talk about the product, and when I travel all over the country, and most of the people who follow what I do, I'd say at least 90% of them, when I say, who's used Vetericyn, 90% of the audience raise their hand. I joke about it, but it's kind of true. I nickname it the holy water because it's the closest thing that I've come across to holy water. But it doesn't matter what you use on it, it works.
Clinton Anderson joining us. Again, you see him on Down Under Horsemanship. Clinton and Dr. Brad and Scott, we have some callers on the line. We gave our telephone number, and again, if you're just joining us, you can join the conversation. Toll-free number is 877-731-6733. We're going to go to California first. Scott, out there. This is Lynn. Lynn, welcome to our program.
Well, thank you very much, and this is really interesting. I'm sure it's interesting to everyone, and I don't have any horses, but I love them. I'm interested in them, and what I was wondering is Vetericyn good for scratches or grease heel?
Yes.
Go ahead, Doc.
The important part about applying it is to try to get rid of any bio material that's there so the Vetericyn can get in contact with the skin. But yes, it's very, very good for scratches, thrush, any of the problems that we have with the feet and lower limbs.
Very good, Lynn. Thanks for the call. And as we, again, Lynn leaves a line open for you. Toll-free line's open. So when you hear, or if the line is ringing busy, please give us a call then. And we're going to go to Florida. Linda, our next caller. Linda, welcome to our program with Vetericyn and with Clinton Anderson.
Thank you very much. I have a horse that back in July, he had a sarcoid on his leg. And so they had sewn the cisplatin beads in. And anyway, that was in for about 3 weeks. And it's left a pretty, it was a pretty substantial wound there. And what I had been putting on it was called Quadratop ointment. Anyway, now in the last week I haven't put anything on it. But it's popped up pretty angry looking again. And I was wondering if that would be good for me to use the Vetericyn on.
I didn't hear that.
Yeah, Clinton, did you hear that? I mean, we can ask. We'll ask Dr. Gordon as well.
I'd ask the vet on that more than me, to be honest.
I didn't hear the whole question.
Linda, can you respond or give again the situation that you have?
Yes, back in July, I have a horse that had a sarcoid down on his leg.
Sarcoid.
So they sewed the cisplatin beads in, which is the chemotherapeutic drug. And anyway, it was in there for about 3 weeks. And it left a pretty raw-looking wound there. And as it was healing, I was putting the Quadratop ointment on it. Anyway, in the last week, I haven't done anything, but I've kept it wrapped. I changed it like every 3 days. And I was just wondering, would the Vetericyn be a good to use on this?
Yeah, thanks for redoing that. Dr. Brad wanted to make sure he understood what you were asking.
Thank you, Linda. The Vetericyn's good for wounds and healing tissue, but if the sarcoid is still present and the roots are deep, and there are 3 different types of sarcoids, so you could have some deep roots. Once that gets aggravated and injured, that can come back with a vengeance, and that's the reason we don't usually do surgery on those, because that'll stimulate and we'll end up with a regrowth that's worse than what we started with. So it might be worthwhile having someone look at that to see if it needs to be frozen or injected with an immune product, and then apply the Vetericyn after that.
Very good. Linda, thanks for the call. And again, as she leaves this, and now line open for you. Clinton Anderson joining us as well, Down Under Horsemanship. Clinton, this is, we mentioned at the top of the show, kind of the changing of the seasons here now, and our friends, 4-legged friends, are maybe moving out of pasture, changing their routines. Talk a little bit about some of the factors that might be in play here that would, again, cause an infection or a wound of some kind.
Well, earlier you were talking about, we're a little early just yet, but starting January, you're going to start having foals being born all over the country. So, getting their umbilical cord, dipped in it and taken care of with the Vetericyn products is very important. But, a lot of people will bring their horses in during the day or nighttime during the winter months and then turn them out during the day. Anytime you're turning a horse out, and especially from confinement, if you've locked them up for 2 or 3 days in a row and they haven't been turned out, I have a rule. I never turn horses out in the pasture that have been locked up for, at least 3 or more days without exercising them first in a round pen or an arena or getting that fresh off them, because if you just turn that horse straight out into the pasture, I've seen a lot of horses galloping around and kicking up their heels and having fun, and they'll run through a wire fence or smash through something and really cause a lot of damage. But I kind of have a rule: you never turn out a horse in a big pasture that's real fresh and on fire. You know what I mean? Meaning that he's just got pent up energy. So turning a horse out is real important for their exercise, but making sure that you set them up for success where they don't run through a fence where you have got a big injury to heal.
And you've had that happen, I'm sure, with fence wounds, traveling. We put horses in trailers and travel the country. Talk to our viewers about people that may have just flesh wounds from traveling. What do you do with Vetericyn?
Well, basically, it just depends. If it needs stitches, of course, you get your vet, you come out and you stitch it up, and then after that, I really just spray it with Vetericyn. I try to do it at least 3 or 4 times a day. Okay, if it doesn't need stitches and it's kind of an open wound, depending on the wound and where it is, I may bandage it and I may not. If it's kind of on a leg wound, especially if it's up high, I probably won't bandage it. I'll just spray it 3 or 4 times a day. If it's a lower type wound that's kind of around the dirt a little bit more and laying down in stalls and things like that, I'll often have a tendency to spray it with Vetericyn, then put the gel on it, the Vetericyn gel on top of it, and then wrap it. And then I'll usually wrap it about every 24 hours. Take it off, reset it again, spray it with Vetericyn, let it dry for 30 minutes, spray it again, put the gel on top, etc., and do it again. But the biggest thing that I found for taking care of horses' wounds with Vetericyn is that, anytime you have a wound on an animal, it is sore and it's irritated and it's angry, okay? And when you're trying to doctor these animals, they don't often want you doctoring them because, you are pressing on the wound or a Band-Aid or pulling something off, etc. So it hurts them. So, we're trying to be their caregivers, and they're kind of looking at us like they'd like to get the hell away from us. But one thing I notice about Vetericyn, because it's very pH neutral, it doesn't sting, it doesn't irritate the wound. So especially for wounds around the eyes, I can spray Vetericyn around their eyes and into their eyes, actually. I'll use it a lot with horses that have weepy eyes and things. I can spray it directly into their eyes, and it doesn't sting, it doesn't irritate them. So after the first day or two of treating a horse with Vetericyn, they actually start relaxing more and more and more, and then they're not frightened of you, they're not worried about you, etc. But, previously with different wound care products, when you're treating that wound, I remember as a kid, you get peroxide on your knee or something like that. Hell, it stings like hell, and after a few days, you don't want anybody coming near you. Horses are a lot the same. So when you're applying a product to a wound that doesn't irritate it and doesn't hurt the horse, it just makes doctoring so much easier. All
right, Dr. Gordon, he mentions fencing all the way back in Iowa and traveling around the country. You have seen a lot of fence post wounds. Talk a little bit about you're sharing your experience with that and Vetericyn.
A lot of fence posts, and then it doesn't matter what type of fence there is. There's no fence that's 100% safe for horses. And getting the wound initially rapidly and getting it medicated and applying the Vetericyn is very important to a rapid turnaround of that wound. And as the weather changes too, it's also important to make sure that a person checks their fence if they haven't during them out in the pasture for a while to make sure the fences are still up, there aren't any holes around the fences, limbs that are down, making sure they have plenty of fresh water if they're out, and then windbreak as the winter comes along so they can get out of the terrible winds.
Yeah, very good. All right, we have another caller on the line here. This is from Florida, Darlene. Thank you and welcome to our program.
Hi, how are you?
It's fine. Go ahead.
Okay, I first learned about Vetericyn at Road to the Horse a couple years ago. We bought 2 bottles, brought it home, and I hadn't used it, but my standard poodle got bit under the eye. She had about a 1/2-inch gash. I mean, By the time I got to her, it was just blood everywhere. I thought her eye was gone. And I got her cleaned up. I thought, I want to use that Vetericyn. It said they can spray it right in the eyes. So I sprayed that on her, cleaned it all off, wrapped her up with gauze and vet wrap and everything. She looked like a football player. But 2 days later, I took it off, and I started using the Vetericyn every day for 10 days, completely healed that. Not a scar, nothing. You couldn't even tell that she had that done. But the best one is my male. I had long hair on him, and I shaved him, and I found this wound. This thing was about the size of a baseball. It was gross looking. It was bleeding. It smelled. I went, wow, what in the world? I couldn't believe it. So I started spraying it 3 or 4 times with Vetericyn every day, and in 30 days, it's totally gone. He's fine. You can't even tell that was ever there.
Wow, how about that?
Darlene, if you have any pictures, I'm sure that Scott would love to have you send before and after pictures if you have them.
Yes, I'm going to. I took pictures of the eye and of the before and after, and we also use it on our horses too, but haven't had to use it so much there.
That's a great story, Darlene. We get a lot of stories like that come into our website, testimonials from folks. And, Clinton was talking earlier about the time when you actually need to take a wound to a veterinarian, or when you think that, hey, this is something that I can take care of. And if you do have a severe wound, which we've had in the backcountry, in the mountains of Idaho, there have been times where we get it stabbed with a stick on a mountain trail, and you need to go to a veterinarian. Have a bottle of Vetericyn with you, and just keep that wound clean and moist until you can get to the veterinarian. We've had a number of veterinarians that have appreciated having a wound come in that's been taken care of with Vetericyn.
You can't hurt anything with the application of Vetericyn.
Pretty good graphic pictures here, by the way, but this is what we want to show you. Dr. Brad, talk about what we're seeing here.
This was a head wound from a fence post that peeled the skin back, and you can see the skull by the blaze on that horse, and they applied Vetericyn at the farm and brought it in. We applied Vetericyn as we cleaned it up, and that's with the head stapled. Unfortunately, there are no follow-up pictures because they took the staples out and things were fine, and they didn't feel like driving back in to have us take pictures of a healed wound.
Interesting, Darlene mentioned, I believe, I wanted to get your thoughts before we go back to, I have a question for you, Clinton, here about eye and ear irritations. But she mentioned there was hardly any scarring. Is that something that you're not going to say every time, but it's something you've witnessed as well?
Yes, and especially with burns where you end up with some scars, because the hypochlorous acid stimulates the ingrowth of new blood vessels, and it improves the oxygen level at the application area for up to 72 hours. We get much improved healing.
Very good. Again, just joining us, you can join the conversation. We hope that you will. Our telephone lines are open, toll-free, 877-731-6733. Again, visiting with Dr. Brad Gordon, Scott Van Winkle, or Clinton Anderson by telephone, joining us on our program here during our hour. Clinton, back to you. A question regarding where you are and traveling around the country, inclined to get and see a lot of eye and ear irritations. Talk about how you have used Vetericyn in that eye and ear product or a situation where you have some infection.
Well, basically, different times of the year you're going to have horses that get and some horses are more prone to it than others. I'm not sure why, but they'll get kind of weepy eyes. They'll get some gunk in the corner of their eyes. The flies, especially this year in Texas, have been exceptionally bad. So I've had quite a few horses in the pasture develop weepy eyes and so forth. Well, we'll bring them in the barn. We'll treat them with Vetericyn 3 or 4 times a day, spray it into their eyes. Probably 4 or 5 days later, their swelling and irritation out of their eyes gone, and then we can turn them back out in the pasture again. So I've used it a lot on eyes, and eyes are a very difficult thing to treat on horses because, they're sensitive about their eyes. It's hard, a lot of horses, to get ointment in there correctly, especially if that ointment stings them or irritates the eye. And a lot of medicines will do that. Even though they might be good medicines, they do irritate the area when it's first put in there. So I found it to be very beneficial when treating their eyes. I haven't had a lot of ear issues, to be honest with you, but anytime we do have any sort of a cut or a scrape or something around the horse's head, Vetericyn's pretty easy to put on, especially with an ear. You can put the gel on it, okay? If you don't want to spray it around the horse's ear, you can put the gel on it with your finger. It's just to be perfectly blunt with you, it's just kind of idiot-proof product to use. You know what I mean? It's like, it's just like spray it on there and walk away and just come back 3 or 4 days and do it. I hate to make it seem that simple, but that's kind of what the product is. It's kind of like, listen, if I can use it and get success with it, and I'm not the sharp Spencer on the box, anybody can.
Mark, we have a lot of people with field dogs this time of year that use it as a preventative so their dogs don't get swimmer's ear when they're out doing field trials and hunting, and people that take their dogs to the lake during the fall and the summer that end up with water problems in their ears. A lot of people use it as a preventative, and it works very, very well. And
there's what it looks like there, again, the ear products that Dr. Gordon talks about. Speaking of new products, Scott, we talked about, early in the show, we were going to talk about, of course, the Vetericyn for our animals and pets and our friends, four-legged friends, but we promised to talk about for humans of a Vetericyn product made by the makers of Vetericyn, and you've got some new bottles there. Talk about that.
These are our eye and ear care products that we were just talking about before I go into the human side of things. So as Brad was saying, this is great for sporting dogs, especially after a day in the field, cleaning out the eyes, cleaning out the ears. If you do good ear and eye maintenance, you're not going to have issues down the road. Now, the new product that we just recently launched is called Puracyn Plus, and this is our
Puracyn,
brand new our human health line. You can actually buy this at Rite Aid, Walgreens, and Meijer stores if you live in the Midwest. This is based on hypochlorous technology, which is the same thing that our Vetericyn Plus products are based on. It's safe, it's non-toxic, you're not going to harm any healthy tissue. It does a very good job at cleaning up the wound beds, scrapes, sunburns, cleaning the face, even down and around your feet. It's a very versatile product.
Yeah, talk about that. I mean, sunburns, rope burns, but feet. We talked about that when we introduced the product, the Puracyn, how much it helps. I think it was Dr. Bongiovanni talked about how many people she treats that have foot problems.
Yep, that's exactly right. Yeah, because it contains hypochlorous solution, you have the antimicrobial properties. You also, have the oxygen properties as far as increasing oxygen in the wound site. So there's a lot of things that this product really helps, clean a wound for. Whether it's a skin irritation or a wound, it's very versatile. It can even be used for little kids.
Very good.
It's FDA cleared. It's doesn't sting. It's non-toxic. Doesn't stain, and it's really easy to apply, especially to children.
Doesn't sting and doesn't stain. We want to make sure we clarify. I mean, that's important too when you talk about a human product and clothes and things like that. Clinton, I want to talk to you too about the new product for humans, Puracyn, and how you might use that. But we have a caller first. This is Don, been holding on from Illinois. Hi, Don.
Hi. I have a question. I have a 6-year-old quarter horse gelding that I show halter with, and he ended up getting injured. Now it's about 7 weeks ago. A metal T-post went across his right rear leg, right below the hock joint in the front of the leg. The vet came out, did stitches on it. We wrapped it for about a week, and we were treating it that first week with Vetericyn. And then the wound kind of expanded, and the stitches came out, and the vet came back out, and we had proud flesh showing and stuff, and I was treating it each day. I was hosing it off, and I've been having to put a product called Prouds off around the outside. And then I put Shriner's herbal solution on it in the evening, and I treat this leg twice a day, and it's still quite large, and the wound sticks out. It's about 4 inches in circumference, and every day the vet's having me peel the scabs off of it. If I was using the Vetericyn, could I leave the scabs on, or would it be beneficial to use the Vetericyn and peel off the fresh scabs?
Those are nasty wounds, Dawn, because of the stress on the wound, and it's hard to hold sutures in that location. The Vetericyn will moisten that scab, and by moistening the scab, it'll be easy to wipe that off. And what we get a lot of people that do with those chronic granulation wounds is to apply apple cider vinegar for a day or two, and that'll eat the granulation tissue back. And we follow that up with a couple of days of the Vetericyn. And by working back and forth with that combination, a lot of our clients that are out in the field and don't have the time to bring their horses back in say that really cleans those type of wounds up fast, especially when they're under a lot of stress and the movement tends to keep things pulled apart and irritated.
You know, I'd like to add something to that if I could.
Please.
You know, leg injuries, especially from the hocks and knees down, you know, it's not uncommon for those type of injuries to turn into proud flesh. It's hard to get the skin, especially when stitches are involved. It's hard to get the skin to stretch over a joint. Obviously, horses play, they're active, they pull the stitches out, etc. As a good rule of thumb, I will say this, is that, you know, Vetericyn is phenomenal at building tissue and making things grow. So obviously, if it's proud flesh, this would be one area to the exception, and Dr. Gordon could argue with me on this and say it's wrong, but I wouldn't put Vetericyn on a wound that is proud flesh. Now, you go back and forth, like you said, like sometimes we'll have a proud flesh wound where we'll use Panalog, a steroid-based product, which shuts a lot of that growth down, and when that growth starts to get shut down, and we want it to heal again, meaning that grow tissue, anytime I want it to grow tissue, I put Vetericyn on it. Anytime I'm trying to get rid of growth tissue, I don't put Vetericyn on it. I'll put some sort of a steroid-based product on it, etc. You know, you can use your own home remedy, whatever you want to do, but it will not work real good on proud flesh because it'll just keep encouraging growth. What you're trying to do is get rid of growth, but like Dr. Gordon said, you have to go back and forth. You're going to use one for a while, and whether it's a day or two or a week, I've had some wounds where I've used a steroid-based product for a week to get rid of growth, and then I've used, you know, Vetericyn for 2 or 3 days, and then I've got to go back and forth and back and forth. Well, would you want to argue that point, Dr. Gordon, or would you agree?
No, Clinton, that was a great summary. That kind of sums everything up.
Very good. Hang on, Clinton. We're going to take our last break here, a little long, but we're going to take a break, come back, talk to some more of our viewers, and ask you a few more questions and talk to our panel as well. Vetericyn and Clinton Anderson back with you and your telephone calls, 877-731-6733. We'll be right back after this.
This one time I fell on these rocks on my elbow. That was painful. I fell down on the toilet. I hurt myself on the corner. I fell off my bike. I got a big cut here.
For all those scratched up, scuffed up, scraped up times, there's Puracyn.
This other time I was hiking and I fell over a tree branch. #painful.
Puracyn cleans the wound with no antibiotics or steroids. It's Puracyn, and let the healing begin. Find it today at these fine retailers.
And welcome back to Rural America Live, our friends from Vetericyn, and again, guest Dr. Brad Gordon from Des Moines, Iowa, and Clinton Anderson from Horsemanship, Down Under Horsemanship, joining us by telephone. And we're going to, with just a couple of minutes left here, we're going to go to our telephones and try to get a couple of more calls in here. This is Kevin from Idaho, who held on through that break. Kevin, thanks for doing that. How can we help you tonight?
I've had a dealer tell me that the pink eye spray was even more effective on wounds than the regular wound care spray because it had a higher concentration of the whatever this stuff is in it that makes it effective. And I'd like you to discuss that for just a minute. A second question, I'd like to know what the significant difference is between Puracyn and Vetericyn.
All right.
I can take those.
All right.
Yeah, Kevin, you bring up a good point. We do have a product on our livestock line called our pink eye spray, and it's available in a 16-ounce bottle, and it's got a high-pressure hose nozzle specifically focused on debriding and cleaning out the eyes of bovine cattle. We designed that product a little bit differently, specifically for the higher organic load that you typically find in a livestock situation. You can see on the screen there we're treating livestock there. So it's been specifically tested for pink eye. But again, yeah, it is based on hypochlorous solution, and it is an over-the-counter product. It's available, you know, at your farm and ranch stores, and so that can still be used on wounds as well.
And then he said that Kevin asked about the difference between Puracyn and Vetericyn.
Yep, they're very, very similar. The main difference between Puracyn is it's gone through all of the FDA clearances to be used for human skin tissue. But it's based on hypochlorous technology. All of our products are manufactured right at our home office. We do all of our own manufacturing and product development there. So everything's done in-house.
All right, very good. Kevin, thanks for the call. I'll try to get one more in at least, maybe more. This is Gloria from Texas. Hi, Gloria.
Hi.
Go ahead. You're on with our panel.
Yeah, I started using it 3 years ago because of Clinton Anderson. But what I want to know is it says it should keep it cool or refrigerated. And I tried bringing it home, then I needed it at the barn. So now I'm leaving it at the barn, and it gets pretty hot in Texas. So does that delete it or what?
All right.
The only thing you really want to be careful of, Gloria, is it freezing. If it does freeze solid, it will inhibit the hypochlorous. As far as being out in the sunlight, if it's extended amounts of time, it can potentially degrade the product. But if it's just warm weather or higher temperatures, you shouldn't have to worry at all.
We've had clients that have noticed that as long as it has that kind of bleachy smell to it, it's still very effective.
And Clinton, you have that in your trucks when you travel the country as well. And it's, as she says, it's hot in Texas, so just keep it out of the sun, right?
Yeah, I'm going to be honest, I don't even worry about that. I worry about the freezing. The only thing I worry about Vetericyn is don't have it freeze. So in the wintertime, we'll have where we keep it in the barn. My barns, one of my barns is not insulated real well, so we just have it under a heat lamp. As long as it doesn't freeze, you're good to go. But no, to be honest with you, we leave it out in the sun all the time, and it works just great. You know, maybe we shouldn't, but we do, and I've never had a problem with it not working. But yes, I stay away from it freezing, and that's about it.
Before we get another caller, hopefully one more here, Clinton. We hadn't talked to you about Puracyn. You take care of your horses, we know that, and use Vetericyn. What about Clinton Anderson and using Puracyn?
Well, yeah, I have a bottle of it in my truck. I have a bottle of it in my trailer, in my shaving bag. You know, if I cut myself, shaving or something, or get a blister on my hand or so forth, sometimes when I go to some tours, I'll have some horses kind of drag me around the arena and so forth. And if I get some rope burn, I'll just use it on myself. So, I tell people this all the time. If it breathes, it can die and get hurt. Not if it's going to die or get hurt. It's just when and how bad it is. So I tell people, keep a bottle of Vetericyn in your barn, keep a bottle of it in your horse trailer, keep a bottle of the Puracyn in your house, keep a bottle of it in your makeup bag, your shaving bag. It's not if your horse is ever going to get a cut or a scrape or an injury. It's just when and how bad. I kind of joke to people, but it's actually kind of Murphy's Law. The more you love your horse, the more you try to take care of him, especially the more money you spend on him, the quicker they're trying to kill themselves, okay? If somebody gives you a free horse, the damn thing will never die, okay? Because nobody cares about it, and it'll be fat and happy forever. But you spend a lot of money on the horse, you take care of it, you want to make sure it looks good. They're always trying to get hurt. So, the joke is have it around you all the time, because it's not if you're going to need it, it's just when you're going to need it.
We're going to try to get one more call, but I think we're out of time. We want to leave each of you an opportunity for some closing thoughts here. Clinton Anderson, we're going to start with you by telephone. Thanks for joining us for our time tonight. And of all the things that you've talked about here, what do you want to leave with our viewers?
I just want to leave, when you need it, you'd better have it. So it's cheap enough to have in several locations, you know what I mean? Don't underestimate when you're going to need it, because when you do that, you'll be caught and you'll be in trouble. So have it everywhere you can, in your truck, your trailer, your barn, your makeup bag, your shaving bag, in your home. It's good for all animals.
And real quick, is there a success story that you, in about 30 seconds or so, that you want to share that really comes to mind that proves how Vetericyn works?
The one I have is from the first time I ever used it, to be honest with you. That first time I ever used it, and I'm thinking, okay, this is really basically water in a bottle. This is not going to work. And when I used it on it, it was a really bad cut on a horse's side on a rib cage, about an 8-inch gash. And by the time I found it, it was too late for stitches. And I thought, man, when this heals up, it's going to be a big old mess, a big old scar. And I'm telling you, an 8-inch gash on a horse's rib cage, I put Vetericyn on it 3-4 times a day. 30 days later, it was completely healed up. The scar was practically nothing, and it blew me away. So I'm firsthand. This is why I got get in contact with Vetericyn because of my first-hand exposure to it.
Very good. Clinton Anderson, thanks for joining us. Wish we had more time, but we're certainly glad you're part of our RFDT family, and God bless you.
No worries. Take care of yourself, guys. Thank you for everybody calling in.
Clinton Anderson joining us tonight. Dr. Brad Gordon, about a minute or so here, your closing thoughts.
Mark, Vetericyn and Puracyn are as safe as it is powerful, and the only limitation of the use of either product is a person's imagination. You can't go wrong using it. It won't hurt anything. So you're better off using it than not using it.
And a quick story there that you like to tell, just a couple seconds here?
Too numerous to bring up. I mean, there are a lot of success stories that were miraculous because of the Vetericyn.
Very good. Good to see you again,
Thank
Doctor.
you.
All right. Scott Van Winkle, thanks for joining us as well. You have the last word.
Well, thanks everyone for tuning in tonight. It was a great show, and thanks, Clinton. You always make me laugh every time I listen to you. You know, it's been a great partnership with RFDTV. You know, building the brand, and the viewers out there have been an instrumental part to our business, and so thank you for that. And as we develop new products and new technologies, they'll be launched right here at this show. So.
Well, thank you very much. We appreciate that partnership as well, and know that a lot of times viewers ask, how can I thank Patrick Gotch for putting on the music and entertainment and all the shows? And he says, use the products we talk about. This is a great example. Use Vetericyn, see your local veterinarian or those stores and that we talked about, Rite Aid, Walgreens, and use the product. And with that, we're going to close things out. You can also go to their website and learn information as well, or to the website we mentioned earlier, or if you'd like to order products, 866-318-3116. Operators still standing by, and they'd be glad to talk to you tonight. For all of us here at RFD TV, I'm Mark Oppold. Good night from rural America's most important network.